Welcome to part 2 of my presentation, An Introduction to Pharmacare, Drug Prescribing, and Working with Pharmacists in BC. In this video, we're going to talk about drug spending in Canada and British Columbia. The first question that you may be asking yourself is how much does Canada spend on healthcare? This figure is from the Canadian Institute of Health Information, and this is data from 2019. And it shows that in 2019, Canada has spent $264.4 billion on healthcare. This is a 3.9% increase in growth compared to the previous year and works out to approximately $7,000 per person. Canada spends 11.6% of its GDP on healthcare. So how do health expenditures vary across Canada? Again, this is a figure from the Canadian Institute of Health Information, and this is data from 2019. And it'll probably come to no surprise that in rural areas, for example, the areas up north, such as the Yukon, Northwest Territories, or Nunavut, their health expenditures are significantly higher. In British Columbia in 2019, our health expenditures per person was about $6,500, which is slightly below the national average of $7,000. So where does the money come from? There's actually a 70%, 30% split between public and private sources. 70% is public, which is composed of provincial and territorial government's money, in addition to other public sector. The 30% private are out-of-pocket payers, private insurance, and other. And this 30-70 split has been relatively consistent since the early 2000s. This pie chart shows the various categories of healthcare expenditures in 2019. It's interesting to note that the three largest categories, hospitals, drugs, and physicians, make up 57% of total healthcare expenditures. Drugs, both prescription and non-prescription, made up 15.3% of total healthcare expenditures in 2019. Let's take a look at some drug expenditure data from BC. This table is from the Pharmacare Trends Report, and let's compare the data from the two dates that I've outlined here in red, 2008-2009 and 2014-2015. Comparing the two, we see that in a 6-year span, the number of claims increased from 26 million in 2008-2009 to 32 million in 2014-2015. And this is an increase of about 20%. However, the ingredient cost actually decreased slightly. So why did this occur? Well, in 2010, the BC government started to regulate the cost of generic drugs. Prior to this, the cost was not regulated, and the government simply paid the lowest submitted cost from the generic drug manufacturers. However, in 2010, the BC government told the generic drug manufacturers that they would only be willing to pay 50% of the cost of a brand name drug. So, for example, if a brand name medication costs $2 per tablet, the BC government said that they would only be willing to pay $1 per tablet. Over the years, the amount that the government is willing to pay has slowly decreased, and today, in some cases, generic drugs only cost about 8% compared to the cost of a brand name medication. Also, a couple big generic drugs became available on the Canadian market during this time. For example, generic Lipitor or Torvastatin became available in 2010, and generic Crestor or Rosuvastatin became available in 2012. Let's take a look at the Pharmacare drug expenditure data from 2014-2015 and compare it to 2019-2020. Again, I've outlined these two columns in red. Here we see that the number of claims in a 5-year span increased from 32 to 36 million. But if we look at the ingredient costs, it increased significantly from 721 million in 2014-2015 to 996 million in 2019-2020. So what happened during this time period? Between 2016 and 2017, Pharmacare added about 500 generic drugs to its formulary and also started to cover about 50 new brand name drugs, which included medications to treat opioid use disorder, antipsychotics, factor Xa inhibitors, and antivirals. So what are the top 10 drugs prescribed in BC by the number of prescriptions? Most of the drugs on this list are the ones that you would expect. Ramipril, atorvastatin, levothyroxine, amlodipine, salbutamol, rosuvastatin, amoxicillin, metformin, acetaminophen with codeine. Lorazepam might surprise you, but there can be regional differences in medication prescribing. For example, in Alberta, where there's a higher incidence of respiratory conditions, their top 10 list would include an inhaled corticosteroid. When we look at the top 10 drugs in BC by cost, it's a much different picture. This list is composed of antivirals to treat hepatitis C, which are highlighted in yellow, biologics, which are highlighted in green, antipsychotics, which are highlighted in blue, and methadone, which is highlighted in purple. Methadone may surprise you, but this is the result of the opioid crisis in BC. Also in February 2014, we switched from dispensing methadone in Tang to commercially available products, such as Methadose. When we look at the top 10 drug classes in Canada by cost, we see a similar picture. There's biologics, there's antivirals, and there's antipsychotics. One thing to note is that these 10 drug classes account for 36.1% of total public spending. And this is similar to British Columbia, where the top 10 drugs by cost make up about 38% of total drug spending. When discussing the cost of medications with patients, we also need to consider medication adherence, because the cost of medications can be one of the reasons why patients do not take their medication as prescribed. According to the World Health Organization's definition of medication adherence, is the extent to which a person's behavior, in this case taking medications, corresponds with agreed recommendations from a healthcare provider. And it's estimated that 50% of patients do not take their medications properly. It's estimated that medication non-adherence costs Canadians $7 to $9 billion annually. And this is due to complications from poorly controlled medical conditions and also hospital readmissions. One important thing to note is that the costs associated with medication non-adherence are preventable. There's 5 dimensions of adherence. The first one is social and economic factors, which includes limited English proficiency and low health literacy. Most health literature meant for the general public is not easily understood and should probably be written at a grade 6 level. The second dimension is healthcare system related factors, which includes provider-patient relationship and also provider communication. So our relationship with our patients and the way that we communicate with them can play a big role on whether they take their medications as prescribed. The third dimension is condition-related factors. So for example, medication therapies which are used to treat a condition which is asymptomatic, the patient may actually feel worse taking the medication than they did before. And also chronic therapy, having to take a medication for the rest of their life. The fourth dimension of adherence are therapy-related factors. For example, having a complex regimen, having to take medication several times during the day. Medication therapies that have no immediate benefit, so some therapies actually have a delayed onset. Medication that cause significant side effects or expensive medications. The patient's beliefs and concerns as to whether the medication will actually help. The fifth dimension of adherence are patient-related factors. For example, patients with impaired vision, hearing, cognition, or memory. Some patients have limited mobility. Patients who live in rural areas will have decreased access to medications and to healthcare. Some patients have poor dexterity and they're not able to open the child-proof cap of the vials. And some adult patients are unable to swallow tablets. If you have a patient who's having difficulty with medication adherence, please get their pharmacist involved. Pharmacists can help to manage adverse effects. We can assist with simplifying medication regimens. So for example, we can recommend a combination product and that'll decrease your patient's pill burden. We can recommend extended release drug products. So instead of having to take a medication 3 or 4 times a day, they just have to take 1 tablet once a day. We can also take a look at all your patient's medications and make recommendations as to which medications your patient no longer needs. We call that de-prescribing. For patients who are unable to swallow tablets, we can compound medications into alternate dosage forms, such as suspensions. We also offer compliance packaging in the form of dosettes or blister packs. And if medication cost is a factor, we can help patients navigate through pharmacare and third-party drug plans, policies, and procedures. Thank you very much for watching. In the next video, we'll take a look at BC Pharmacare.